Health and Hygiene. This presentation will discuss the importance of a food handler's health, hand washing, use of bare hands, and employee hygiene. Foodborne illness affects many people each year. The Centers for Disease Control and Prevention estimates that 1 in 6 people in the United States will experience food poisoning each year. Food employees and volunteers may not work with the food or food equipment if they are sick with vomiting, diarrhea, or a fever with sore throat. A food employee or volunteer may not work if they have been diagnosed by a health practitioner with an illness due to norovirus, hepatitis A, Shigella, E. coli, Salmonella, or other foodborne associated diseases. Good hand washing is essential in preventing the spread of germs that cause foodborne illnesses. Food workers should wash their hands before beginning to work with the food, after handling raw meats, when changing their gloves, after smoking, eating, or drinking, after emptying the trash containers, after using the toilet room, and any time your hands become contaminated.
Hand washing should always take place at the designated hand washing station. If a hand washing sink is not available in the food service area, you must supply a hand washing station. The hand washing station must include a container of fresh water with a free-flowing valve, liquid hand soap, paper towels, a container to catch the wastewater, and a waste container for the used paper towels. The fresh water container shall contain approximately 5 gallons of water and have a valve that allows the water to flow freely without having to be held open. Many insulated beverage dispensers, coffee dispensers, and camping water dispensers have this type of valve. Additionally, portable toilet rental companies often have portable hand washing stations that you can rent for use in your food service area.
Remember to always wash your hands at the designated hand washing sink or hand washing station. Wet your hands with water, then lather your hands and wrists with soap for 20 seconds. Rinse your hands and wrists, then dry them with the paper towels. Use the paper towels to turn off the faucet or valve and dispose of the paper towels in the waste container.
Ready-to-eat foods may not be touched with the bare hands. Gloves, utensils, or products like deli tissues must be used by the food employees and volunteers. Ready-to-eat foods are food products that will go directly from the food handler to the customer without being cooked. These would include, but are not limited to, items like hamburger and hot dog buns, cheese, lettuce, tomatoes and onions, pickles, potato chips, desserts. Food employees and volunteers shall wear hair restraints such as hats, visors, and hairnets. If beverages are consumed in the food preparation and service areas, they must be in covered containers such as a bottle with a cap or a cup with a lid on it. It is best to store beverages in areas away from the food and food equipment. Eating, chewing gum, and smoking are never allowed in the food preparation or food service areas. This is the end of segment 2. Remember, never work with food if you are sick with vomiting, diarrhea, or have a fever with a sore throat. Always practice frequent and thorough hand washing. Never touch ready-to-eat food with your bare hands.